So ASCVD is the leading cause of cardiovascular morbidity, and it is reaching alarming and epidemic proportions, very high mortality.
So the root cause obviously is the risk factors. The most important thing is that it is the multiple risk factors with their minimal or modest elevation is much worse than the extreme elevation of a single risk factor.
We see myocardial infarction a decade earlier, we see diabetes a decade earlier, the disease is malignant, more frequent revascularization and so on.
That we normally say that our increase in the risk factors is at a borderline level, and that is what is something which our physicians tell you all the time. That is what the patients feel, and they feel quite happy about it, that their blood pressure is only borderline elevated, or their sugar is borderline elevated, or their cholesterol is borderline elevated. There is nothing like a borderline elevated thing. We blame genetics as one of the non-modifiable risk factors, but the fact remains that if we take care of other risk factors or modifiable risk factors, we'll be able to mitigate the genetic risk also to a significant extent.
LDL is causally related to atherosclerosis. So, what do you think should be the level of LDLs?
Our level should be what we are born with. The inspiration, as I was always said, is Dr. Braunwald, because there is no confidentiality breach here. And as he has always said, that he is the longest surviving human being on the statins, and his levels have always been in 20s. The European Society of Cardiology has started to say that when you are at a very high risk, you should be able to bring your levels to under 40.
The problem is we have several oral medications. The problem with oral medication, even with the PCSK9 monoclonal antibodies, of adherence and compliance.
Problem is that most of the risk factors, they basically are asymptomatic because there is no manifestations of them. And once we start to treat them, there is a possibility of making them more symptomatic. And that is where the compliance starts to fall.